Hello, everyone. Welcome to another episode of the Reframe Summit by She the People and powered by Gayatri. My name is Swarnima Bhattacharya. I'm the co founder and chief product officer at Gayatri, which is a trusted platform for women's holistic health. Speaking of holistic health, today we are here to discuss something about mental health and the way it connects with our entire overall health. We're going to talk about nutrition, hormones, and mental health, specifically also with a focus on gender and women. Why is this conversation important? It's important because whenever we are talking about mental health, we're talking about stress, anxiety, feeling better, our mood shifts, etc. One of the things that often gets ignored in conversations around mental health are what are the physical factors that drive it? What are the physical factors that might impact your mental health? And what are the factors which conversely can also improve your mental health? One of those factors is gut health and nutrition. There is a lot of research now that shows that the hormones that are basically in our body, for example, if there is a gut dysregulation or something like that, it impacts everything. It impacts our mental health, our reproductive health, our heart health. In fact, there is research now that is also showing that women's hormonal shifts also affect bone health. So, with this background in mind, I'm very, very happy to have a stellar panel, of people who are going to really have, sort of lead this conversation on how to boost mental health with better nutrition, especially for all the women out there. So I'm excited to have this panel, and I'll be introducing everyone, one by one. Thank you so much, ladies, for joining us today. We have Dr. Sudeshna Ray, who is the Chief Medical Director at Gayatri and gynecologist for about more than 30 years of experience. She's a head of gynecology at Jaslok, and she is just somebody who, has been such an empowering influence on different kinds of, policies and advocacy for women's health. So very, very glad to have you, Dr. Sudeshna.
Thank you
uh,
very much, Karma.
then we have Shraddha. Shraddha is a therapist with over 12 years of experience. And, she is somebody who has not only worked in CBT, but she also uses, different kinds of therapy like art therapy to also help, push the mental health conversation. Thank you so much for joining, Shraddha.
Thank you, Swarnima.
Thank you. And of course, we have Neha Ranglani, who is an integrative nutritionist and health coach with over 15 years of experience. And in the last 3 years, she has already authored 3 books as part of a reboot series. Because, I think what you basically do, Neha, is talk about nutrition, health, and, self care at the intersection of that. So we're so glad to have you today. Thank you so much for joining.
Thank you so much, Swarnima. It's a pleasure.
All right. So, to start off the conversation, I think let's start with the basics. Dr. Sudeshna, I would like to start with you just to set the ground. Uh, Tell us a little bit about the role of hormones in women's mental health.
Okay, so everything that a woman is influenced by hormone. Everything that a woman does, everything that a woman uh, looks or feels is definitely influenced by hormones. Now, actually speaking, the hormones, mental well-being, women are three different topics which are together connected. And now that we are on this stage talking about them, we have to realize that each one of them individually needs a lot of attention. Okay, hormones are chemical messengers that influences every organ and every function of the body. Mental well-being is your ability to connect emotionally, and more importantly, balancing within. And women, why these two topics are so uh, like so very talked as a gender discriminant. So this is a very, very important determinant in mental well-being, because whatever a woman does, uh, because it's influenced by hormones, the mental disorders or the mental illnesses or the mental conditions that we talk about are also more prevalent in women. Men also have an influence of hormones on, but they are not as dramatic, because they don't go through the phases that a woman goes through, the daily phases, the monthly phases, the event phases that a woman's life go through. So it is very, very important for us to make people aware that they are all connected. Mental well-being, hormones are very, very connected, and hence it is important that we understand uh, the role that it plays.
Absolutely, that's exactly right. That, and we're going to come back to this question about what you just mentioned very crucially. That when it comes to women's lives, then there are several life cycle events that play such a crucial role in mental health, etc. And we'll come to that point. So speaking of the connection that you highlighted, Neha, I'll come to you. Uh, there is a lot of science now and a lot of evidence that is supporting this, that there is a huge correlation between gut health and mental health, as with gut health and every other types of this thing, or including reproductive health, etc. So can you tell us a little bit more about that correlation and what science is now saying about it?
Well, yes, very rightly, our gut is known as the second brain, right? Because it has an entire nervous system which operates independent of your brain. So it can do a lot of things without your brain support. And this nervous system takes care of a lot of things that impact our mental health and our emotional health. So our gut has the serotonin, the happy hormone that we talk about, is produced 95% in our gut and only 5% probably in our brain. And this serotonin impacts the way our nervous system communicates with our brain, and then overall has an impact on the way we perceive life, the way we think, the way we feel, and impacts our overall mental and emotional well-being. So it's extremely important to take care of your gut. And what affects your gut is the food you eat, is again the way you react, the thoughts you have, um, how well you feed the good bacteria in your gut, because we have trillions of microbes in our gut that do a lot of functions, and they actually help in producing serotonin as well. So we need to make sure that we are feeding our gut the right food, which does not damage the gut lining, which does not feed the unwanted or the opportunistic bacteria and microbes in our gut. Because when they grow, we increase the amount of toxins and toxicity in our body, which thereby then affects the serotonin production and affects the way we feel and the way we think. So a lot of depression and anxiety cases are actually happening because of poor gut health. So I see a lot of people with anxiety, and once I start correcting their gut health, and once we work on improving the gut microbiome and correcting the dysbiosis in their gut, they start going off their anxiety pills. They start feeling better. They don't feel depressed anymore. There's a zest for life. They start feeling enthusiastic about life. They start having more positive thoughts. And that shows that there's a huge connection in how our gut impacts how we feel. So, yes, it's beautiful.
Yeah.
So it's
No, you're
basically
exactly right. Yeah. Mhm.
so it's basically true of the old saying that you are what you eat.
Yeah.
Yes,
In fact,
absolutely.
you are not only what you eat, you are what you eat, digest, absorb, assimilate, and you utilize in your cells. It's actually
Exactly.
that extensive and that vast. It's not just what you put in your mouth, it's how your gut makes use of it and sense of it and then
Yeah.
provides it to your
Yeah.
cells.
Exactly. And that is
So
an important point that you made, Neha, that it's not just about what you eat, but also what you digest, and not just in terms of food, but in terms of emotions and
Emotions.
our response to stimuli, etc. And this is important, this is a good point in which to bring in Shraddha. Shraddha, when we talk about emotional health, you've been a
yeah,
therapist for over 12 years. You have, I mean, and especially in India, over the last decade, you must have seen a sea change in the way people are
yes,
approaching therapy, in the way people are
yes,
approaching
yes.
therapy, right? So, I will talk about accessible therapy towards the end. But one thing I would like to ask you is that when it comes to, any kind of emotional health needs, not only mental illnesses, but also just emotional health needs overall,
Yes, yes.
how does therapy, whether it
Mhm.
is CBT or various other therapeutic modalities, how can they help and how can people access all of this?
Yes, yes. So if we see, I would just like to give a brief background about mental health and the practices. Um, as Dr. Sudeshna and Neha very rightly said, that body and mind, they are not separate. They are just two sides of the same coin. Yeah, it's just the flip side. Yeah, and we have to look at everything. We cannot separate the mental health from whatever the life stages we go through, or if there are some medical conditions that we are going through. Now it is very important to see every aspect of our life. We need to look at, as therapists, we need to look at what medical condition this person is going through, at what life stage this person is. And when we talk about how therapy helps, we look at the everything, the overall view, and then we can pick out things that this is the area which needs help. This is the area where we need to do something. Now, how therapy helps, or how therapy works, or why therapy works. Uh, to to discuss that, when we are having sessions, when we are doing therapeutic interventions, we bring about some form of awareness to the client. So that is the first step towards achieving the goal of having good mental health or having good health, overall health. So bringing that awareness is what is more important. Once you are aware that what the issues are, there could be there are gynecological problems, and related to that, there can be depression, there can be anxiety, or there, as Neha also had suggested, that what you eat, what goes in, yeah, is after all what runs in your body and mind. So now, when we are looking at therapy, we take a holistic view. We bring about more awareness about the issue. We bring about the acceptance that yes, it's there. And when you accept, then definitely you get some direction. People feel empowered when they go through the therapy. Initially, when they are feeling lost, when they have a feeling that they are just losing out on everything, or everything is just falling apart. From that emotion, from that feeling, they reach a stage where they feel empowered, they feel in control of their own emotions, they feel their life is in their control and they can go on what is happening around them. Yeah, so this is how therapy actually helps, and there are various modalities. There is art therapy, there is arts-based therapy, there is cognitive therapy, behavioral therapy, various modalities. And I'm pretty sure that most of the therapists use eclectic approach, where they are not focusing only on one therapy or one modality, but they kind of use a combination of all, looking at the individualized needs. And that is also a very important aspect of any therapy, because it's not something that is written in the books and just followed. It is more individualized, it is kind of customized based on the needs of the client. So that's how
Yeah.
therapy helps.
Yeah, I mean, you're exactly right that, many a time, a mixture, and I know this is how you practice therapy as well, that,
Yes, yes,
not
yes,
everyone responds that well to talk therapy. Not everyone knows how to start, when it comes to talk
yes.
therapy. And there are various other ways of, getting that conversation going and getting that awareness going. So, here I would like to segue to Dr. Sudeshna and come back to the point that you said about changes in life cycle. There's, of course, when girls are hitting puberty, then there is pregnancy. These days, sometimes even before pregnancy, there are treatments to bring about pregnancy, which lead to huge hormonal shifts again. Then postpartum, then perimenopause, and then menopause. And of course, every month we have our periods. So, I mean, it feels like a bit of a roller coaster. And it feels like something that, women are just, doing. And, we have when we're talking about women specifically, we have spent decades advocating that women are not hormonal. It's not that, because women are being hormonal, women being emotional, that has kept women away from spaces of working, spaces of paid work, paid labor, politics, etc., etc. But how do we reframe that conversation that, it's not just women that are hormonal, everyone is hormonal. And being hormonal is not a bad thing. Understanding those hormones and, having a healthy clinical approach to that hormone or to those hormones, that is the important part. So can you tell us a little bit about the role of hormones and its impact on mental health? And what do we need to keep in mind, given women's, very natural changes in life stage?
Right. So, as you rightly say, that everybody's hormonal. Everybody's hormones do influence their physical activities and their mental as well as physical well-being. But they are not as dramatic as women, as I previously said. That that's why women are perceived to be more, that word is associated with women, dramatic. Always
Yes.
she does the drama, but the drama is not always in her control. It is always at the backstage, some kind of a hormonal uh, upheaval going on. So the roller coaster ride is a very important for everybody to understand, that just because women are accepting the roller coaster ride very gracefully and very easily does not mean that their physical and mental um, health is not fighting with it. They're continuously adjusting with it. So any breakage in that system, any breakage in that lining, uh, makes them shift to a little abnormal part very easily. So pregnancy is one, as you saw. We start with puberty, bang with puberty. Then comes the pregnancy. Then comes the before the pregnancy comes the premenstrual. Premenstrual also hormones are. It's almost every month a challenge that a woman goes through. Then comes the pregnancy. Then comes the postpartum. Okay, and then comes the perimenopause and the menopause. So it's never ending saga of drama. So this, we have to understand the hormones that are responsible for it. Now we are not going to talk about the scientific part of it, but we have to understand that there are some, like in puberty there is a whole surge of sex hormones. In pregnancy, in premenstruation, let's talk about premenstruation. There's a lot of adjustments of the body to the fluctuations of the hormones, monthly hormones. In pregnancy, there's huge lot of adjustments, and the entire pregnancy is a role of the placenta and the ovary to begin with, and the also contributed by the medications that a woman has through the pregnancy. Then comes the postpartum. Now, postpartum, imagine the 9 months of change of hormones is going to come all back to normal in those 6 weeks. So the tremendous uh, impact of that on a woman, especially when they are almost feeling like nobody, feeling like nobody other than a mother, other than like, either breastfeeding or taking care of the child, not taking care of herself, not taking care of anybody. Everybody's focus throughout the pregnancy is on her, and suddenly the whole focus changes to a baby, and she's supposed to not care about anything else except the baby. So other than, apart from the hormonal changes that she's going through, these are the social and um, you know family changes that happen, uh, also contributed by the fact that they don't like themselves to see themselves in the mirror after a childbirth. They don't like that version of themselves. That also contributes to the some kind of mental blue always. And almost every woman goes through some kind of blues in the postpartum. They say that we never thought that it would be so real. Some, of course, will need a little more aggressive therapy in terms of treatment, but most of them go through these blues. Then comes the perimenopause. I mean, it's like those 40, 45 years, you're standing tall, confident, and then suddenly this storm of menopause comes, and then it might sway you, it might bend you, it might even break you. So these are things which are not in control. I want everybody to understand this, that this is not a woman's fault. So that is very important for us to understand, especially the men. I have, in my talks, I have repeatedly said that men around these women have to understand these are not in control of the woman, and they need to be seen from a different lens and tackled with a little more sensitivity and a little more delicately, I would say.
Yeah, that's exactly right. I mean, also, the thing is that whenever we talk about women's health and also mental health, whether with regards to women or otherwise, it is, both the clinical research and cultural understanding of both. It's both a bit, lacking. It's clinically as well. We talk about judgment or misdiagnosis, delayed diagnosis, and various, such pathologies when it comes to women or when it's related to mental health. And cultural understanding, cultural support around these things, is also very poor, especially in, underserved economies like India. So, Shraddha, I'll come to you.
You know what?
What,
Can I?
yeah,
You
sure,
know
sure,
what?
sure.
So biased is the culture around us.
Yeah.
Now that we're talking about women, so far we haven't really spoken about. Now it has been a very, very important topic of global contemporary
Mm,
healthcare. But the word hysteria, like we are
yeah.
talking ages back, hysteria is coming from the word hystero, which means the
Yes.
uterus.
The
So
uterus,
women
exactly.
and mental imbalance is somewhat
Hmm.
accepted. Oh, she's a woman. She will behave like this. You know,
Yeah.
and
Yeah.
I have also heard women talking about women, and that pains the most. The
Yeah. Yeah.
women,
Yeah.
we should be
Absolutely.
together to understand each other and to understand uh, this kind of, to fight against this kind of a bias that
Yeah.
society has.
Exactly. I mean, like, not to sort of digress, but there are so many, like, sort of like theories around, the idea of culture and language. We always say that uh, that language and culture is very androcentric, which basically means that the idea of culture, the idea of language is very male centric in that way. And of course, I mean, it's the idea of language itself. It's very colonial. It's very androcentric, so to speak. And I think when we are questioning things like hysteria and its very problematic roots, or even, the slightly, racist sort of roots of gynecology, then it's really like, changing the game for the way medicine works. And that is exactly why we feel that when it comes to any healthcare platforms, not just Gayatri, but every other healthcare platform that is operating in the global south, they are not only playing the role of treating and healing people, but like really changing the narrative around how healthcare is understood, in our world. So
Absolutely.
towards that, Shraddha, there was another conversation that we were having as part of Reframe, that when it comes to mental health, it's not just about topical anxiety and topical depression, but also around systems. Many a time, especially when it comes to women, sexual harassment, workplace culture issues, having to manage work, and family, especially for a new mom and things like that. And sometimes this cultural and social support is so lacking. So it's not just something very minor and something not very which is very personal, but it's also systemic. How does that get addressed in therapy, specifically when women are very rightly frustrated that there is not enough childcare, or there is an invisibilization of women as they age, etc. There are so many socio-cultural things that come into. So how yeah, so how does therapy sort of address both the personal and the systemic, when it comes to women?
Yes, yes, yes. So when we are talking about the entire scenario, we can be a little hopeful about the new generation that I feel. I will come to your question, but I had something in mind to talk about the point that Dr. Sudeshna had raised,
Sure, sure.
that females being judgmental of other females, and very particularly when I see the cases of postpartum depression, the husbands are kind of more probably not aware, but then they are able to receive what the therapist is telling them. But uh, the difficult part is where that female's mother or the mother-in-law comes into the picture, and then it's like so it is also very cultural, and I mean this is also a systemic, because they feel that they have already had their own children and they never went through something like this, some depression of this sort, and why this new generation has these issues, and it's just nothing, so they just want to brush it off. Yeah. It is very important that we, as therapists, make them understand that it was always there. So the systemic changes will not happen in one day or not even in a decade. It would take a lot more time and effort, a very systematic effort in that direction. Um, Definitely, what we can do as therapists at our level, at individual level, is making people aware, making the client aware that this is happening and whatever is happening is wrong. You are right in your place, whatever you are feeling, whatever the emotions you are going through, it is true. It's not a drama, or it's not something that you have made it up. It is very much true to yourself, and you're really going through it, but there are ways to come out of it. That's not the end, that whatever you are feeling and it's the full stop. It's not like that. But first step is understanding, and making the family understand. That is how the change starts. Okay. So whenever there is a client coming to us, we make it a point that we talk to the significant others in the family and make them understand that this is a real issue. However, they probably would be thinking previously that it is just something that is going on in the head, and it is just something that this person has made up. There is no, or probably they have a feeling, the parents or other elders in the family have a feeling that they have gone through lot many difficulties in their own lives before, and this is something that is very trivial. Yeah. But what they go through, what this person is going through, is very subjective, and it's true. It's not something that is false. So then it takes a lot of effort as a
So
therapist.
yeah.
Yeah. Yeah.
Yeah, I think,
To
given, I think the idea of being heard, the idea of being validated, I
yes,
think that goes a
yes,
long way in,
yeah,
and also I think not being instructive, but being supportive. I think that is
yeah,
something that
yeah.
therapy
Exactly, exactly.
really,
Yes.
helps with. So that's
I
great.
have seen, yeah, I have seen this in therapy setups that when we are talking to females, they are taken aback when we tell them
Yeah,
that this is okay to feel all these emotions. It's all
yeah,
right. Yeah, and it's quite natural. I mean,
yeah.
the when females go through postpartum depression, they are like, "What is happening with me? I want to come out of this phase as quickly as
Mm.
possible."
Yeah.
You will go through this phase. Everybody goes through it, and we need to be more accepted. I mean, we need to accept it more. Like, yes, this is phase of my life, and I need some time to come out of it.
Yeah, yeah,
That is
absolutely.
very important. Yeah.
Yeah, I mean, we are so afraid of anything that is a bit, and this is, not just for women, it's also for men, more for women, but also for men, that the moment something is a bit out of the normal, we just want to quickly just, it's like something, what I think a lot of people in public
Come back to normal.
come back to normal. And that this is like a huge thing in the public health space, which I in my previous life used to belong to, is that the it's called the pill popping problem. Like every thing should work like a pill, but it doesn't. Systems and processes do not work like pills. And speaking of that, Neha, I think I want you to have the last word on this, since we are talking about boosting mental health with better nutrition. And you already spoke about how the gut is the second brain, and a lot of evidences, not just in terms of that, not only just in terms of moods, but there is also evidence now that suggests that prevention of dementia, and things like that can also be done with, the right kind of nutrition. So, talk us through a little bit about brain food. It's quite a term out there. So, can you deconstruct that a little bit for us, and what does that really mean for women and their mental health?
So, like Dr. Sudeshna also rightly said, also Shraddha rightly said that our mind and body is not a separate thing, right? So when we talk about brain food or food for mental health, it's not different from what is actually good for your entire body, for your systemic body, for your entire, organ system or cells in your body. It is one structure of food which is good for you is the wholesome natural food that you eat in your day-to-day life. The problem is, this is how our ancestors ate, but now it's become a very alien topic, because now people are living on convenience food, people are living on junk, and we are eating foodless food, we are eating food which has a lot of additives, preservatives, a lot of stuff which our body doesn't recognize as nutrients because they are not nutrients. And that has sort of become the norm. So now, to educate people to come back to eating things that grew on a plant rather than made in a plant is become education, which was the way of living for people like till my grandmother's age or till my father's mother's young age, because now even they eat processed food because that's just what is available. So we are living a lot on biscuits, breads. We have a lot of influential people in the media space, in the celebrity space, promoting these foods and saying, eat these high fiber biscuits, eat these low fat stuff, whereas we all know what these products are. So they are definitely not your brain food. They are the foods which take your brain to literally a downward spiral, so they do not nourish your brain. In fact, they cause inflammation in your body. So inflammation in your gut because of these foods is inflammation in your body, is inflammation in your brain, and that's why Alzheimer's, and that's why dementia, and that's why all the memory, focus, concentration issues that are coming up today. So the basic structure of your diet should be 80% you eat foods which grow on a plant. So all your fruits, vegetables, your nuts, your seeds, sprouts, pulses, and eating stuff which have the nutrients in it. So I don't say today the nutrients in a food are is as enriched. Our food is not as enriched as it was still 50 years back, because again there's a lot of soil explosion or exploitation that's happened, right? Because of all the fertilizers and chemicals and everything that we've used. But still those foods have nutrients. So eating your walnuts and your nuts and your flax seeds and your seeds gives you omega-3, which is great for your brain. Okay, having your healthy sources of protein, not the inflammatory ones. So not overdoing on meat and milk products in the name of protein, but doing a lot of beans and sprouts and nuts and seeds, which give you the protein, but also reduce the inflammation in your brain. All right. So these are the things which actually feed the good bacteria in your gut, lower the inflammation, and thereby they lower the inflammation in your brain as well. Because if there's insulin resistance in your body, there's insulin resistance in your brain as well. So a lot of diabetics, people who have belly fat around, visceral fat around their belly, they have insulin resistance, which is a major problem, which creates a lot of hormonal imbalances, which affects your thyroid, which affects your periods, which affects your mental health, because your brain also gets insulin resistant. So glucose is not entering your brain. So that's why you can't focus. That's why you can't think straight. That's why you can't feel happy. That's why you cannot remember things. And that's where we, head towards Alzheimer's and dementia and all the mental health issues, all the brain issues for that matter, because we are not nourishing our body and we're not taking care of the inflammation. And we are not feeding the good bacteria and the good microbes in our gut. So it's simple. It's simple. Eat something that's natural. Avoid packaged processed. 80% of your diet. I'm saying because see, we have a lot of socializing happening. We have a lot of convenience foods around us, so it's not always easy to keep them away. But 80% you can surely keep them away. 80% you can plan your meals. So I always tell my clients, I said, sit on a Sunday with your family or with whoever is the decision maker of your meals and plan a menu for the entire week. Sunday to Monday, you plan your entire menu, and you put in things that you're going to eat as a family, or depending on what health issues you have. And once you plan, it's easy to organize, it's easy to buy groceries, and it's easy to stick to it. And it's less likely then you will want to order on Swiggy or order unhealthy things, or order, or just buy a pack of food which has no nutrients in it, because you've planned your meals, you've organized your week, and you're motivated to follow it.
Yeah.
And that's how
Yeah.
you're nourishing your body. That's how you're taking care of yourself, because you want to do that, right? Most of the times we land up eating unhealthy is because we have not planned our meals. So, we sit and think, "Arey, kya banaya aaj, khana kya banaya, what should we make? Chalo yaar, we'll order something. Or, okay, let's get some ready to eat stuff. Or let's just munch on a pack of chips." So that, and also stock up healthy things in your kitchen pantry. What out of sight is out of mind. So if you don't stock up all the junk, you won't
Yeah.
see it, you won't eat it.
Exactly. So true.
Don't buy it.
Yeah, yeah, totally. I mean, what you just said is actually very right. That if it is there, if there's something weird in your pantry, you will consume it.
Yeah.
And once you stop that, because this happened a lot during COVID, right? I mean,
Yeah.
a lot of people did stack up on convenience foods and all of that, and yeah, I mean, things became quite strange that way. So thank you so much, Dr. Sudeshna, Shraddha, Neha, for your inputs. I think. My key takeaway from this, if I have to summarize it for all of
But
us, is
if
very
I
simple.
can,
Yes,
if I
yes,
can
please,
express one, sorry.
please go
First of
ahead.
all, thank you, Neha. Thank you. This is really an eye opener that you sit with
Yeah.
the family and make the menu, because I've been doing that on a Sunday, every Sunday for the next week, just for my convenience, so that I don't have to think in the morning before going to work that what to make.
Yes,
Yeah.
But it's a great idea that definitely there will be something like, why have you kept this? Why not this? And
yeah,
then this comes in, then the tomato comes in. So this is a great idea I'm going home with. So I'm going to
Thank you.
implement
Thank you.
today itself. Okay.
yeah.
Thank you very
I
much for
will.
that. I wanted to say this, that I so agree with Neha, is that the entire conversation about different kind of hormonal problems that we are having, like that women are facing, that polycystic ovarian syndrome, or even irritable bowel syndrome, endometriosis, all
Mm,
are very linked. And the
yes,
main word that links is inflammation. And the inflammation comes with the gut. If that's corrected, a lot of inflammation goes down, and a lot of expression of these conditions will also go down. That's such an important point to make.
absolutely. Also, I think, yeah, that's exactly right. I think the key takeaway over here for me would be that when we are talking about you know, of course, with increased awareness and increased conversation online about healthcare, for better or for worse, I mean, it has its pros and cons, this kind of narrative, but we have tended to sort of, slice and dice our health, gut health, reproductive health, mental health, adolescent health, etc., postmenopausal, and that's great because it allows us to sort of deep dive into all these healthcare, markers, and really like put forward research. However, it is important to sort of bring it all together
Yeah.
and also talk about the culture around it and the clinical research around it. A lot of people are, they talk about gut cleanses and detoxes, etc., and that's great. But what is important to understand is that ultimately, what is the idea? Ultimately, the idea is for you to feel better and for you to be more creative, more productive, more healthy, to sleep better, etc. So I just want to conclude this conversation by adding one of my favorite things that I always keep talking about, as is not that not only health as an illness, but also health related quality of life. If even
Yeah.
if you're not diagnosed with a condition, even if you're not diagnosed with something like a chronic condition or something like that, you know you need help mentally and physically, whatever. If you're not feeling very productive, if you're always feeling fatigued, if you're not sleeping well, if you're seeing that you're not communicating well with the people that matter around you, etc., all of these are indicators that something somewhere is off. And either you need to see your doctor, or you need to see a therapist, or you need to see somebody who you can talk to and get things straightened out, right? And thank you so much for this wonderful conversation, Dr. Sudeshna, Shraddha, Neha. It was, I think there are a lot of things that each of you said that can be deconstructed further and deep dived further on. And I'm sure we'll have opportunity to do that in the coming days. Sure, Neha, please go ahead.
I just want to say one line, and it hit me really hard. I read it somewhere. It says, "Nothing tastes better as feeling good feels."
Oh, this is so good. This is so
Wonderful.
true. This is
Right?
actually wonderful. Yeah.
Yeah.
And all this while, we've only been focusing on our taste buds. But if you actually focus on feeling good and doing things, lifestyle activities, food, um, thought processing, emotions, meeting a therapist, meeting the right doctor, meeting the right nutritionist to take care of yourself, then feeling good is the most important factor. And then taste buds are not as important as that.
Yeah.
So, nothing nothing tastes as good as feeling good feels. So
Yeah,
it's
absolutely. This
extremely
is
important.
such a good.
In continuation with that, is that today the whole era is about specialization in medicine. You know, we are specialized in, kidney, heart, brain, reproductive system. So these compartments are great because a lot of focused work can go. But an individual is an individual which needs to be looked over on. And that's where we need to start seeing the woman as a complete individual with her brain, kidneys, heart, lung, reproductive system together. So the mental health, the gut health, the reproductive health, the hormonal health, all becomes an integral part. So the care has to be integrated. And if you go to a specialist, but they will give you, I mean, if the specialist gives you something, uh, particularly to repair that, that will always have something to do with the nutrition, that will always have something to do with your mental health. So do not ignore those two and take only the specific medications that somebody has given you. It is also an overall advice that the clinician gives you to all the women out there, that it's time that we integrate our care system together to give you that feel good feeling.
I'm so happy, Dr. Sudeshna, you said this, because most people don't even throw light on lifestyle and food and therapy. And most doctors are only focused on medications. And I have clients who've come and told me that the doctor said, no, just take this and just follow a decent diet and you'll be good. And it's so undervalued. And I'm so glad that you threw light on this, that it's an entire gamut of things that work in correcting a person's health, and not just focusing on one
Absolutely.
aspect of
Yeah,
any
absolutely.
type.
And
Yeah.
on that note, I just want to thank you guys again, because see, this is a conversation that's going to keep up here already. This is a conversation that can and should go on. And thank you so much once again for giving us your valuable time and your thoughts and your expertise on this topic. And yeah, thanks.
Swarnima, can I just share one thought?
Please, please
I
go
would
ahead.
just take 1 minute. Yeah, I'm
Yeah,
very happy to be part of Gayatri because it's a dream job any therapist can get, where there is holistic support given to females. And I'm so happy to be part of this, and so much insightful learning that all of us have got today. And I'm looking forward to having such more sessions where all of us are going to benefit from. Yeah, thank you so much for just having it for all of us.
thank you. Thank you so much, Shraddha. Thanks to the She the People team and all of you for coming and staying and engaging so deeply. And yeah, thanks a lot. Have a good evening, good morning, all of you, and a good weekend. And to everyone who's been watching, please feel free to share your questions, thoughts. You can find us on our socials, and if you have any follow-up questions or thoughts, just reach out to us. Thank you so much.